think our very own Mayor Michael Nutter does not need introduction. So I will defer to the mayor because I know that at this stage of the day he is late about an hour and a half for whatever it is that he's doing. So without further ado, please welcome our very own Michael Nutter.
Dorit, seriously, thank you very, very much for your hard work and effort and commitment. We've had a chance just in the two short years that I've been in office to do a bunch of things, many announcements, and I'm very excited about the LGBT healthcare town hall meeting. As we saw, I guess it was last year, many of these healthcare town hall meetings were quite interesting. I'm going to assume this one will not be as exciting as some of those we saw in other parts of the country, but I want to recognize, and I think he's right over there, Marty Sellers. So good seeing you. Thank you, and your partners, business partners, Brian Dorsey and Harvey Hurdle. Thank all of you for the great work that Sellers Dorsey is doing. The panelists, is this the Rebecca Fox? Donna Ross, I'm sorry. And Ernest Hopkins and Dr. Robert Wynn, thank you very much. I'm going to be really brief because you want to get on with what you're doing. Chris Labonte, thank you, Principal at Sellers Dorsey, and Gloria Caceres, the Mayor's Office Director of LGBT. Health issues would be of particular great interest, certainly to Gloria, doing a great job under some challenging circumstances. But Gloria, quite frankly, provides inspiration to many of us in city government. And so I know you gave her a round of applause for her job, but now I'm going to ask you to give her a round of applause for just what she's dealing with. This event today, literally coming about a week or so in the aftermath of the great healthcare debate, and finally, even more importantly, the great healthcare vote, and signing into law by President Obama. And we have to give our president all of his props for hanging in there, never giving up, and showing once more, especially a great lesson to our young people, but for all of us, that if you just stay focused, if you keep working hard, if you don't give up, no matter what people are saying, no matter what they're doing, no matter what they're throwing at you, you can actually be successful on the important things that make this country such a great country. And for that, we all owe President Obama a great debt of gratitude and service for what he has done. There are still some challenges, of course. There's generally no one bill solves all problems. I've spent 14 and a half years as a legislator, had a chance to do a bunch of good things, but there's always still work to be done. And there are still many challenges and issues, certainly that affect all Americans, but there are some in particular that have a particular impact on the LGBT community. A couple of those are certainly still the ongoing issue of the taxation of domestic partnership benefits, the issue of providing Medicare benefits before people have developed full-blown AIDS. All of these issues still vex and challenge us here in the United States of America, and there will be continued need for efforts directed at making sure, especially people in the LGBT community, have proper access, appropriate access, great access to health care, that funding stays in place for AIDS and HIV testing, that from time to time when budgets get tight, folks are always looking around for a cut somewhere, and all of us need to tighten our belts. But there's some areas where we actually need to invest more, and this is one of those areas, and a number of others. I am particularly pleased, and you know that tomorrow is the official Census Day. I know it's also April Fool's Day, but this is no joke. April 1st is Census Day, and we've even seen now a shift with regard to the census, and that people who are same-sex couples get to put on their form that they're a couple. And for some, maybe that doesn't, I'm not saying that that's the holy grail, it's not the greatest thing since sliced bread, but there was a point in time where you couldn't. And we need to recognize when we make progress, let us recognize it, announce it, celebrate it, and then push for more. And I want to encourage anyone who has received your form and not sent it back, please make sure you send your form back. It's not doing us any good sitting on your table, stuck up under some other mail. It's not a bill, it's not a bad thing, and actually it's going to bring the city more money for healthcare related issues, daycare slots for our children, programs for our senior citizens, community building dollars, and on and on and on. So please make sure you fill out your census and check whatever box or boxes are appropriate, but I want to make sure that we deliver that message as well. Lastly, of course, everyone deserves good health. And I'm very pleased and very proud and very excited that the LGBT community is having this healthcare forum. There's still a lot for us to learn about the legislation that was passed, but even more importantly, there's a lot for us to learn about the issue of open access to healthcare. This forum, you'll learn, I know, from these experts on the panel. You're going to take this information, it needs to get spread out to the communities all around Philadelphia and throughout the 5-county region. We can beat many of the diseases that challenge us. That takes research, that takes support, that takes commitment and dedication, and similar to what I talked about with regard to President Obama. Let us all rededicate ourselves to making sure that everyone has access to good health care. Thank you very much.